Hello everyone, welcome back to Mind Academy. So this is our second session on basics of exercise therapy. So we already have completed our four topics, which you can check in the video that I've uploaded in our channel. So we'll start with the next topic now. So our next topic is liver. Okay. So what is a liver? As you can see in the diagram, liver is a rigid bar which is capable of movement about a fixed axis or fixed point, which is known as fulcrum. In liver work, so in liver, when work is done, when a force of effort is applied, okay, here effort is applied at one point, which acts upon another force or weight, which is also known as resistance. Fine, so liver is a rigid bar which has 3 points: fulcrum, effort, and load. Effort is the point at which we apply the force, and load or resistance on which the weight is applied. Okay, so note that to perform an activity or a movement, the bones act as lever and the joint as a fulcrum. So बॉडी में क्या होता है? बॉडी में bones as a lever काम करते हैं और joints as a fulcrum. Okay, the movement will be created by two types of forces: weight and effort, in which weight is the opposing force and effort is the action achieving the force. Okay, so W is the weight of the body parts, and effort may be pulls of the muscle in human body. Now, types of liver. Basically, there are three types of liver: first order, second order, third order. So, first we'll be discussing about the first order liver. So, just remember one formula. Formula is F L E, flea. So, what does this mean? In flea, F is fulcrum, L is load, E is effort. So, when fulcrum is in the middle, it will be class 1 of first order liver. When load is in the middle, it will be second order liver. And when effort is in the middle, it will be known as third order liver. Okay, so which we will be discussing in details. So, what is first order liver? In this type of liver, fulcrum is between effort and weight. Okay, so fulcrum may be shifted centrally towards weight or effort. For example, we have seesaw, scissor, nail cutter, and the most important feature of the first order lever is stability. So it is also called as lever of stability. Okay, in human body we have atlanto-occipital joint, which during nodding movement of the head, neck extensors act as the effort and facial part as weight, and the atlanto-occipital joint acts as fulcrum. Okay, so you can see the diagram here. As per definition, in first order lever, fulcrum will be in the middle. Okay, see, this is the fulcrum, and the characteristic of first order lever is that fulcrum can be towards the effort arm or towards the load arm or the resistance arm. Okay, so normally you can see this fulcrum is the middle, effort is here, resistance or load is here. So the distance between the effort and the fulcrum is known as effort arm, EA. and the distance between fulcrum and the resistance or load is known as resistance arm. Okay, so this is normal main lever. Okay, and in this, if the fulcrum moves towards the effort arm, for example, this one, see, fulcrum is moving towards effort arm. Here, what you will find is resistance arm will be greater than the effort arm. Okay, normally in first order lever, when fulcrum is in the middle, effort arm will be equal to load arm. That's why it provides stability. But since here resistance arm will be greater than the effort arm, here you will find that mechanical advantage will always be less than 1. And in the other one, when fulcrum is towards the resistance, effort arm will be greater than the resistance arm. So here mechanical advantage will always be more than 1. In this less than 1, is in this mechanical advantage is equal to 1. Okay. So here is the example in the human body. There is atlanto-occipital joint. As you can see, this muscles, it acts as the effort or applied force, neck extensors. Okay. Fulcrum is this atlanto-occipital joint, and resistance is from the bones and other facial parts. Since fulcrum is in the middle, so it acts as first order lever. Next, we'll go for second order lever. As I have described earlier, in second order lever, load or weight is in between fulcrum and effort. Example would be wheelbarrow. And this lever is known as lever of strength. Okay. And the example in human body is standing on toes, in which the ball of the toes will be fulcrum, the tendon Achilles tendon is the effort, and the body weight passing through middle part of the foot is called weight. So this is the second order lever. Here, as you can see, fulcrum. Here we have fulcrum, and resistance or load is in between the fulcrum and effort applied. So, as you can see here, the distance between effort to fulcrum is effort arm, and distance between fulcrum fulcrum to resistance is called resistance arm. So here what we are seeing is that effort arm is greater than resistance arm. So since effort arm is greater than resistance arm, the mechanical advantage will always be 1 or greater, sorry, will always be greater than 1. Okay. And example, you can see in the diagram, standing on toe, this is the axis, resistance by the body weight and force by the calf muscles. And third order lever is also known as lever of speed. And in this, effort is always in between fulcrum and weight. Example, the beetle nut cutter, chapati presser. Okay. So here we will always have a mechanical advantage less than 1. So it will be mechanically, it will provide mechanical disadvantage. Okay. And it is called lever of speed. Now it is like third order levers are seen plenty in human body. Okay, you will find third order lever more in human body. For example, human elbow flexion, in which elbow acts as fulcrum, biceps insertion, effort, and forearm and hand weight. Okay, fulcrum is elbow joint, effort is biceps insertion, and forearm hand are the weight. So, can anyone tell me why third order lever is more in human body? Because it doesn't have mechanical advantage. Okay, it doesn't is helps in power. So what's the benefit? Can anyone say? Okay, fine. Third order lever, since it's lever speed, since our ancient time, our main purpose was to flight, to run from the uh, nature, to run from the animals in age-old time. Okay, so from there the evolution started, and that's why we have lever speed so that we can run faster and for protection. Okay, so this is the diagram. Here you can see fulcrum, resistance, effort is here. So your effort arm is always less than the resistance arm. So that's why its mechanical advantage will always be less than 1. So you can see the example here. In elbow flexion, this is the resistance, this is the force or effort applied here, and here is the joint. Since the effort is in between axis and resistance, this is third order lever. Same you can see as discussed earlier. Only thing like normal examples will give like pry bar, load is here. When if you have to lift some heavy load, we use this pry bar. Okay, effort will apply here, fulcrum is here, load is here. So this will be class 1 lever. In class 2 lever, we have this wheelbarrow. In wheelbarrow, fulcrum are the wheels, load in the middle, and effort we give from our hands. Okay, and last one is catapult. In catapult, you can see fulcrum is here, effort will be in the middle, and load at the end. So as already discussed, mechanical advantage. So what is mechanical advantage? It is the efficacy of force in relation to lever, and it depends on two factors: force exerted and perpendicular distance from the fulcrum to the weight arms or the effort arm. Okay, we have two kind of force: effort and weight, and the distance. That is weight arm or effort arm. Fine. So when both weight arms and effort arm are of equal length, that is EA is equal to RA, mechanical advantage will be 1. Means there is no advantage. Now, if the length of effort arm exceeds or is more than the weight arm, then advantage will be gained. So mechanical advantage will be greater than 1. And if the mechanical the weight arm will be more and effort arm will be less, then mechanical advantage will be less than 1. That is for third order lever. Okay. So here, as you can see, mechanical advantage is obtained in first order lever when fulcrum is nearer to the weight than the effort, and in all lever of second order lever. So as I discussed earlier, in first order lever you can get both all the 3 levers. Second order is only power lever of power, and third order is lever of speed, where mechanical advantage will always be less than 1. Next topic is pulley. So what is pulley? Pulley is a grooved wheel which is rotated about a fixed axis by a rope which passes around it. Okay, it is a grooved wheel which is rotated about a fixed axis by a rope which passes around it. Okay, a pulley is basic device or machine made of a wheel with a rim that a cord or rope fits around it. Then the wheel and axle of the pulley makes it easier to lift heavy objects with the rope. Okay, so with the help of wheels, we can lift up heavy object uh, quite efficiently using the ropes. Like we use a wheel while pulling water from the well. Okay, so types of pulley. So first type is fixed pulley. In this, it is an axle mounted in the bearing attached to the supporting structure. See, this is attached to the supporting structure. So this is a fixed pulley, and fixed pulley changes the direction of the force on a rope or belt that moves along its circumference. So what's the advantage of fixed pulley? It helps in changing the direction of the force. So here mechanical advantage is gained by combining a fixed pulley with a movable pulley or another fixed pulley of a different diameter. So if we have with a fixed pulley, we add a movable pulley or a bigger pulley or smaller pulley, which will provide a different diameter. will have mechanical advantage 1. And second is movable pulley. A movable pulley has an axle in a movable block. Okay, the axis will be in a movable block. It will not be fixed to the normal block. Okay, a single movable pulley is supported by two parts of the same rope and has a mechanical advantage of 2. Okay, this type of pulley is used in suspension therapy unit, which makes easy to lift the parts. Fine, as we use suspension therapy in our physiotherapy, so for that only this movable pulley is used. And on suspension therapy, we'll organize a class soon. Then the last one that we have is it's compound pulley. So as the name suggests, it will be a combination of both fixed and movable pulleys from the blocks to tackles. A block and tackle can have several pulleys mounted on the fixed and moving axles. So as more the number of pulley you add, the more mechanical advantage you will get. So this is like one other example of single fixed pulley, and this is the two fixed pulley. One pulley is fixed here, one pulley is fixed here, and the weight is here. Now pulley in human body. See this, I made like 2 slides for this because it's a very important question. It also comes in university exams. Okay, so in human body, mostly we see that patella acts as a pulley. How? As we know, pulley has a wheel, rope, or cord. So in wheel is represented by the bony component, which can be external bone, patella, and bony prominences, condyles, trochanter, and tuberosities. Fine. And the rope or cord, they will be the tendon, quadriceps tendon, muscle tendon junctions. Okay, patella is the wheel, and this is the tendon, a cord. Okay, so as a pulley changes the direction of the applied force, similarly, patella does the same work for the knee joint. The patella helps to support the work of the quadriceps muscles during the contraction of quadriceps that allows extension of knee. So when we go to knee extension, patella acts as pulley and supports the quadriceps muscles. Okay. So here one more diagram you can see patella acts as an external pulley for the tendon of quadriceps and muscle tendon. This is the axis of rotation, quadriceps tendons of femur, and this is tibia. Okay. So this will act as the pulley. This will be the rope. This will be the pulley, which will help in knee flexion extension. So what does patella as an anatomical pulley does? It moves the muscles away, increases the momentum, increases the quadriceps torque, increases the angle pull, and increases the efficiency of quadriceps muscle. So here it is providing mechanical advantage greater than 1. So next we'll move to our topic, that is axis and plane. I hope till now everything is clear. You can just type in chat section, then we'll start. Okay, thank you, Asmita. So next we'll move to axis and plane. So what is an axis? Axis is the line about which the movement takes place. Okay, it is an imaginary straight line around which an object rotates. Okay, and plane is the surface which lies a right angle to the axis and in which the movement takes place. Okay, fine. Movement takes place in the plane around the fixed axis. So the types of axis, there are three types of axis: sagittal axis, frontal axis, and vertical axis. So sagittal axis, it passes horizontally from the posterior to anterior and is formed by intersection of sagittal and transverse plane. Okay, just remember one line. Sagittal axis passes from posterior to anterior. Okay, and frontal axis passes horizontally from left to right and is formed by the intersection of frontal plane and transverse plane. Okay, and the vertical axis passes vertically from the inferior to the superior and is formed by intersection of sagittal and frontal planes. Okay, the sagittal axis passes posterior to anterior, frontal axis left to right, and vertical axis inferior to superior. Now, anatomical plane. What is anatomical plane? Anatomical plane is a hypothetical plane used to transect the human body. Okay, transect and divide the human body in order to describe the location of the structures and the direction of the movement. Okay, so as you can see here, frontal plane. Okay, what is frontal plane's axis? What is the axis? Anterior posterior. Okay, so it is also known as, you can say, coronal plane or frontal plane. Okay, then sagittal plane, it is horizontal, and transverse has a longitudinal axis, as you can see in the diagram. This is the transverse plane, which divides the body into upper half and the lower half. Okay. Then we have sagittal plane, which divides body into right half and the left half, and coronal plane, which divides body into anterior and posterior half. Now we'll explain it more better way. Sagittal plane. So the sagittal plane, also known as the median plane, longitudinal or anterior posterior, is a plane parallel to the sagittal suture, and it divides the body into left and right. Okay? Sagittal plane will divide the body into left and right. Coronal plane, also known as frontal plane, is perpendicular to the ground in human and it separates into anterior and posterior, that is front from the back. Okay, and then transverse plane or the axial horizontal plane is parallel to the ground and it separates the human body into inferior or superior, inferior, upper or lower part. Fine. Upper part is called cranial part, the below part is called caudal part. Now, types of plane, here are the planes. You can sagittal plane. In sagittal plane, the movement is, can anyone name this movement that is happening in sagittal plane? Okay, fine. In sagittal plane, the movements are flexion, extension. In frontal plane, abduction, adduction. In transverse plane, internal rotation, external rotation. Okay. So now we'll discuss about the movements in more elaborate form. So movement in horizontal plane or transverse plane. This plane, as we know, it divides the body into upper and lower halves. Okay. It will go like this and divide into upper and lower half. So movement in transverse plane occur parallel to the ground. Example will be rotation of the head, when nose moves parallel to the ground. The rotatory movement is in the transverse plane occurs around vertical axis of the motion. So movement in horizontal plane is not affected by gravity. Hence, it is stated as gravity-free movement. The movement that is done in transverse plane, it is not affected by gravity. So it is called gravity-free movement. So weak muscles which are unable to produce movement against gravity can often succeed in this plane. So when we see any patient whose muscle strength is not that much, we can use this range for the movements. Then is movement in frontal plane or caudal plane. As we know, the frontal plane divides body into front and back halves. So the movement in the frontal plane occurs side to side. Okay, that is abduction and adduction movement. So rotatory motion in the frontal plane occurs around anterior posterior axis. Then movement in vertical plane or sagittal plane and anterior posterior vertical plane passing through the body from back to front and dividing into half. Okay, in this plane, it divides body into right and left parts. So the movement occurs is forward backward. That is mostly flexion extension, as you can see. Okay. Now this is like a small chart regarding that plane of movement. This transverse plane. In this, mostly rotation occurs. Sporting examples, that is ice skating, pirouette, the rotation of the golf swing. Okay. Then frontal plane, side to side movement, that is abduction, adduction. Example, jumping jacks, cartwheel, star jump, abduction of hip in breaststroke, then abduction of shoulder when shooting a netball. Then in sagittal axis, we have up and down movement with flexion extension occurs. So biceps curls, leg action in running, elbow flexion in the javelin throw and somersault. Now, axis of movement. So plane of movement. So this is like axis. Okay, the frontal axis it runs. See how it runs. Horizontal from the front of the back of your body. This is. So it helps in sideways rotation. So it works with frontal plane. Then transverse, it passes body from left to right. So forward rotation occurs, which occur in sagittal plane. So always remember frontal axis, frontal plane, sagittal axis. So then transverse axis works in sagittal plane, and longitudinal axis works in transverse plane. Okay. So passes vertically from the top to bottom of the body, and here vertical rotation takes place. Fine. Next, we'll go to muscle contraction. Now, a contraction is defined simply as the generation of the tension within a muscle fiber. Okay? If the tension is generated in the muscle fiber, the muscle will contract. Muscle fiber generate tension through actin myosin cross bridge cycling. Okay, actin myosin cycling we might have already read. Under tension, what happens? A muscle belly can either lengthen, shorten, or remain the same length. So, according to the type of muscle contraction, there are two types: isometric and isotonic. In isometric, there is development of force by increase in intramuscular tension without any change in length of muscle. But in isometric, there will be no change in the length of muscle. So, isometric. Iso means no change or static length. And isotonic, the tone will be the same. It will increases the intermuscular tension accompanied by change in length. Okay, here length will change, but the tone will remain same. It may be either shorten or lengthen. So you can see in isometric, lengthening of the muscles takes place, and muscles remain same. Length of the muscle remains same in isometric throughout the contraction, and in isotonic, length of the muscle changes during the contraction. On the basis of muscle work, it's divided static work. Okay, where muscle works isometrically to balance opposing force and maintain stability. Then concentric muscle work, muscle contract isotonically in shortening to produce movement, and eccentric muscle work, where the muscle contract isotonically in lengthening. The muscle attachments are drawn apart. So in concentric, the movement will be towards the joint, and in eccentric, it will be away from the joint. Okay, that's it. This is a simple formula for concentric and eccentric. Now, range of muscle work, there are three range: inner range, outer range, middle range. So in inner range, muscle is in the shortest form. This is the inner range, okay? For this. Then outer range, fully extended portion, and middle range, it is neither fully shortened nor fully extended. Inner, middle, outer. This is the full range. Okay? It is the like for mostly for hamstring, concentric and eccentric. In eccentric, what you see is here is the minimal contraction, here is the medial medium contraction, and when it is extended, it's like full contraction. Okay, in this position. And in hamstring concentric contraction. This will be inner. This is the full contraction, then medium contraction. Then when it's extended, it will be in the minimal contraction form. Then group action of muscle, the muscles act as agonist, antagonist, and synergist. In agonist, the group of muscles which contract to provide the force required to produce movement. For example, we have tricep brachii. Tricep brachii is a prime mover and elbow extensor, while the anconeus is the assistant in the movement. The next we have antagonist. These muscles oppose the action of the agonist and relax progressively for permitting movement. So during elbow flexion, what happens? Triceps must relax to allow the movement to take place. Okay, see the diagram. When you're doing elbow flexion, when the triceps is in relaxed position, then only you can flex the elbow. Okay, so this is like if this agonist, this will be the antagonist. So both work simultaneously. And next we have synergist. Synergist, this group of muscle work with agonist to provide suitable activity and facilitates the movement. Okay, so these muscles eliminate unwanted secondary motion. That's it. For example, forearm extensors lock the wrist in neutral position to allow the flexor of the forearm to apply the action in stronger grip. Okay, so forearm extensor, they will lock the wrist in neutral position so that the flexors of forearm can apply stronger grip. And last is fixators. These muscles stabilize the bones of origin of the agonist and increase their efficiency to produce the movement. For example, trapezius and rhomboids contract to immobilize the scapula during the arm movement. Okay, the four fixators: synergist, antagonist, and agonist. Uh, so that's it for today. Thank you very much. Hope you liked the session. So do like the video and subscribe our channel. Thank you, everyone.